Thyroid cancer is a relatively rare but treatable type of cancer that affects the thyroid gland, a butterfly-shaped organ located in the neck. In this comprehensive guide, we will delve into the definition of thyroid cancer, standard treatment options, its seriousness compared to other cancers, prognosis at different stages, promising therapeutics, unique challenges, FDA-approved medications, and available resources to support individuals navigating thyroid cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is thyroid cancer? Thyroid cancer develops in the thyroid gland, a critical part of the endocrine system responsible for producing hormones that regulate metabolism. The majority of thyroid cancers arise from thyroid follicular cells and are classified into several subtypes, with papillary thyroid cancer, PTC, and follicular thyroid cancer, FTC, being the most common. Less common subtypes include medullary thyroid cancer, MTC, and anaplastic thyroid cancer, ATC. The types of thyroid cancer are, going from least serious to most serious, papillary thyroid cancer, PTC, follicular thyroid cancer, FTC, medullary thyroid cancer, MTC, anaplastic thyroid cancer, ATC, Hürthle cell carcinoma, HCC, and the most serious poorly differentiated thyroid cancer, PDTC. Standard of care treatments for thyroid cancer. The choice of treatment for thyroid cancer depends on factors such as cancer type, stage, size, and the patient's overall health. Common treatment options include surgery. The standard treatment for most thyroid cancers involves surgical removal of all or part of the thyroid gland. This may include a lobectomy, removal of one lobe, a total thyroidectomy, removal of the entire gland, or a lymph node dissection if cancer has spread to nearby lymph nodes. Radioactive iodine, RAI, therapy. After surgery, RAI therapy may be used to destroy any remaining thyroid tissue or cancer cells. This treatment is especially effective for PTC and FTC, which often take up iodine. Thyroid hormone replacement patients typically need to take synthetic thyroid hormones like levothyroxine to replace the hormones their thyroid gland can no longer produce after surgery. External beam radiation therapy. This treatment is primarily used for MTC and ATC, as well as when RAI is not an option. Targeted therapies. Some advanced thyroid cancers that do not respond to traditional treatments may benefit from targeted therapies like lenvatinib or sorafenib. Chemotherapy is typically reserved for advanced and aggressive forms of thyroid cancer, such as ATC. Seriousness compared to other cancers. Compared to many other cancers, thyroid cancer is generally less aggressive and has a more favorable prognosis. Most thyroid cancers are detected at an early stage, thanks to the gland's location in the neck, making them visible and palpable. Furthermore, many thyroid cancers grow slowly and respond well to treatment. Prognosis for Stage 1. Thyroid cancer. Stage 1 thyroid cancer indicates that the cancer is localized to the thyroid and has not spread beyond it. The prognosis for Stage 1 thyroid cancer is usually excellent. The 5-year survival rate for Stage 1 thyroid cancer is estimated to be over 98%. With timely and appropriate treatment, the outlook is highly favorable. Prognosis for Stage 4 thyroid cancer. Stage 4 thyroid cancer, also known as metastatic thyroid cancer, implies that the cancer has spread to distant sites in the body, such as the lungs, bones, or other organs. The prognosis for stage 4 thyroid cancer is less optimistic, with a lower 5-year survival rate. Rates can vary widely depending on factors like the subtype of thyroid cancer and the effectiveness of treatments. On average, the 5-year survival rate for stage 4 thyroid cancer may range from 19% to 67%. However, some individuals may respond well to targeted therapies or other treatments, leading to better outcomes. Why is thyroid cancer tricky? Thyroid cancer presents unique challenges for several reasons. Early detection. While early detection is an advantage, it can also pose challenges. Many thyroid cancers grow slowly and may not cause symptoms, leading to overdiagnosis and overtreatment. Variability in subtypes. Thyroid cancer comprises various subtypes, each with distinct characteristics and responses to treatment. Tailoring treatment to the specific subtype is essential for optimal outcomes. Recurrent thyroid cancer can recur, even after successful treatment. Long-term surveillance and follow-up care are crucial to monitor for recurrence. FDA-approved medications for thyroid cancer. Several medications have received FDA approval for treating different types of thyroid cancer. Levothyroxine, a synthetic thyroid hormone used for hormone replacement therapy after thyroidectomy. Radioactive iodine, RAI. RAI therapy is a standard treatment for PTC and FTC. Lenvatinib and sorafenib. Targeted therapies used for advanced thyroid cancer that does not respond to RAI. Keytruda and Opdivo, immune checkpoint inhibitors studied in clinical trials for advanced thyroid cancer. Cabozantinib, a tyrosine kinase inhibitor used for certain forms of thyroid cancer. Sorafenib, vandatanib. Targeted therapies approved for MTC. An integrative cancer treatment for thyroid cancer that has shown promise in clinical trials is hypothermia, the use of heat against cancer. This is described in more detail in the book Cancer Self-Defense. 101. Quick Tips to Help You Survive. A website to research clinical trials for thyroid cancer is onclive.com. One promising but underutilized FDA-approved treatment for thyroid cancer is radiofrequency ablation, RFA. RFA is a minimally invasive procedure used for its potential to treat small thyroid tumors or metastatic lesions. Organizations and resources for thyroid cancer treatment. For individuals seeking support and information on thyroid cancer treatment, various organizations and resources can provide valuable assistance. ThyCa, Thyroid Cancer Survivors Association, Inc., a non-profit organization offering support, education, and resources for thyroid cancer patients and survivors. American Thyroid Association, ATA, provides information, guidelines, and resources on thyroid cancer and thyroid disorders. Thyroid Cancer Canada offers support and resources for thyroid cancer patients and caregivers in Canada. Thyroid Federation International, TFI, a global alliance of thyroid patient support organizations providing information and support. Navigating a thyroid cancer diagnosis can be challenging, but these organizations and resources offer a wealth of information, emotional support, and connections to others who have faced or are facing similar experiences. It is crucial for individuals diagnosed with thyroid cancer to explore these options and work closely with their healthcare team to develop a personalized care plan. Regular follow-up care and open discussions with healthcare providers are essential for effectively managing thyroid cancer. For more information, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.